Hello everybody, Dr. Shadi Ireifej here, board certified surgeon, chief of specialty, part owner of TrueCare for Pets, Studio City, Los Angeles, California. We're going to talk today about veterinary medical conferences. The most experience I have, of course, is with surgery conferences, as I am a board certified surgeon. However, this may apply to other specialties as well. And this focus is going to be specifically on the quality of the conferences that I've noted over the past decade or so. It's the original thought process, as far as I can tell, behind veterinary conferences and perhaps any sort of medical field in general, is that the point of these conferences were to bring to the community the latest and greatest of most recent research papers and research projects that have been published and reviewed by our peers. It's supposed to be presenting the newest techniques, what the newest gold standard is, what to do and not to do, how does it compare to previous research papers, and so forth. And over the years, I've noticed, especially on the surgery side of things, that the surgical conference has been less and less populated by actual surgeons and becoming increasingly more populated by general practitioners, your typical family veterinarian. Which is nothing is wrong with that, of course. Everybody in the field should have access to the latest and greatest information. That's obvious. However, the surgical conferences specifically, as well as other specialty conferences such as internal medicine or dermatology or radiology or ophthalmology, etc., really are supposed to be tailored towards the specialist. And so what that comes with is information in these lectures given by the best of the best doctors that should be really at the level of a specialist. So, for example, what that typically will mean to me is that the most basic or foundational information of a disease process or a surgical technique or what have you can pretty much be bypassed. To review what is already common knowledge in the veterinary profession might be more on the repetitive side, redundant, and probably not the best use of time at these conferences. People come from all around America and sometimes from outside of the U.S. to participate in these conferences. And so they're looking for information that can only be found in research websites or research papers, or it's information that has not even been published yet. It's not even public knowledge yet. And so they want to know, what are the experts saying about specific topics: surgery, internal medicine, critical care, anesthesiology, whatever it is. To review information on a disease or a technique or a treatment that is common knowledge does not become the best use of our time. We can find that information anywhere, in textbooks, online even, just from veterinary school. This is not groundbreaking information. This is foundational stuff that veterinarians will typically already have mastered. And so we want to know what the latest and greatest is. So what I've been noticing recently over the past number of years is that the population demographics have changed dramatically, at least in the surgical realm, where there are more family veterinarians. And yes, family veterinarians do perform surgeries, everything from the most basic surgeries to the most high tech. But again, the information, these lectures in these conferences are supposed to be tailored towards the actual specialist. So I've noticed a shift in demographics in these conferences. I've also noticed that the lectures themselves have become quite basic. The information is nothing new. It's information that to any veterinarian, especially to the specialist, is common knowledge. We are not really in need of repeating information that's considered foundational. So what's happened is most of these lectures will focus at least 50%, if not towards 80% of their time on the most basic information, and then spend the last half to quarter of the lecture talking about the newest information. And the problem you have with this is that it doesn't leave any room for discussion or elaboration on the most recent up-to-date information. If you're spending 80% of the time on the foundational stuff, well, that leaves 20% of the time to focus on the new stuff without any real discussion thereafter. These lectures are slated to be somewhere between 30 and 60 minutes, with a couple of minutes at the end for questions and comments, and then from there we move on to the next lecture. So it doesn't leave room for elaboration on the more recent information. And if you know anything about medical literature, there is plenty of controversy even between and within research papers. There is no such thing as a perfect research paper. They always have their flaws. And so if you're presenting information on the most recent research paper of a specific veterinary topic, and you don't allow enough time for internal discussion, then there's no time for critique. And if there's no time for critique, well, then you're sort of forced to either come up with your own conclusion, which is fine, but you end up losing the collaborative discussion from this. And you also don't allow any room for challenges. If you take the information presented to you from a recent research paper at face value without questioning the validity of the paper and where its weaknesses are, where its room for improvements are, well, then you either can challenge it, ignore it, or take it at face value. And it's hard to challenge these things without the benefit of having other people's perspectives. So what I would like to propose here with this episode is to figure out ways of changing the lecture format. I certainly don't want to change demographics. I mean, if you offer better lecture series, then the demographics will automatically shift towards having more specialists, which is what these conferences were tailored towards anyway. So I don't think that's a primary problem. That's sort of a symptom of this. What I would like to do is figure out a way for the conferences to basically make sure that they have lecturers who are presenting the most up-to-date information on whatever topic it is that you're discussing, and then from there carry out your lecture. And I think it has to be one where perhaps I would believe that the process by which you would select who is lecturing and on what would be right in the beginning, where you've chosen a lecturer and a topic and you're reviewing their PowerPoint presentation and their lecture notes. That's the time to decide, okay, is this information at the level by which the specialists who are supposed to be attending these conferences will be satisfied? And if you can hit it at that level right in the beginning, then you can tailor those lectures to the audience, the target audience, which in this case would be specialists, and in my case would be the surgeons. I am willing to bet that if we were to use that kind of criteria on these conferences, you would have, it would change the entire way we have these conferences. And they would make them really a thought-provoking, critical thinking type situation, and not just one where we're being fed the same regurgitated information that we've already established in veterinary medicine as objective, absolute truths. The collaboration between doctors, especially specialists, is really crucial to try to hash out what we think as a profession the best techniques to use for a specific disease or best medication to use for a specific disease is. You need that. Because at the end of the day, if something were to go wrong with a specific case, we're going to be referencing the latest literature to find out, could the doctor have done something better? Was there another potential option that could have been used in this scenario to result in a more positive outcome? And if you don't challenge these papers, well then you're just going based on what other people have derived. And as we mentioned earlier, no paper is 100% perfect. So I think the recommendation I'd have for the individuals who are in charge of these conferences is to really weed out those lectures and lecturers that are focusing on the most basic information and try and promote the ones that would instead devote 20% or less of their lecture to the basic information, and those whose lectures devote the next 75 to 80% on the latest information. And that's really the way to go. It starts right at the beginning of the application process, and from there you will have a list of lecturers and lecturers that would actually tantalize your target audience, which in this case would be the specialists. So that's how I see it. Let me know if you have any opinions of your own and what you think should be done. I also do like the idea of having a mixture of both young and experienced doctors, as well as senior experienced clinicians, because the younger individuals will be coming out of their residency programs having been taught ideally the most recent information, but of course they lack the wisdom that you only can attain over time. And the more experienced doctors will probably seem to be a lot more critical of the literature from the clinical standpoint, because what they've been doing for X number of years has worked very well. And if a new research paper is challenging what they've done and what they've known, well, they're going to be a lot more hard-hitting with these papers. Younger veterinarians tend to be a little bit more believing of research papers, and rightfully so, because they are looking for the wisdom of those facilities that provide these research papers and this research data, and they want to be told what the best, most latest information is, because they're still young and hungry for this information. So they tend to take it at face value more so than the experienced, seasoned doctors. At the same time, of course, a lot of the young doctors coming out of their programs may also be more familiar with where the holes are from a statistical standpoint in these research papers, whereas the more the senior clinicians, who maybe don't necessarily read papers all the time or on a regular basis, they may not be thinking about the weaknesses of a paper from a statistical standpoint. They might be thinking about it more from a realistic clinical perspective, a real life perspective. So it's pretty cool to see the two different aged clinicians kind of duke out a research paper is presented at a forum such as a specialty conference. And so it'd be nice to get back to that type of format. Thank you so much for listening. This is Dr. Shadi Ireifej, TrueCare for Pets, Studio City, Los Angeles, California. Keep following our podcast, and just as a reminder, I do have an Instagram profile. I also have a YouTube channel, and we've got this beautiful podcast as well. So feel free to support all our information, and let me know if you have any questions, concerns, or comments, or any suggestions on where to go from here. Thank you so much, and we'll see you in we'll talk to you in the next podcast episode. Take care.